This video will describe the clinical recommendations for the use of Prothrombin Complex Concentrates, or PCCs. PCCs are faster and more effective at lowering the INR than plasma for patients requiring warfarin reversal. We will describe the use of PCCs for warfarin reversal or vitamin K deficiency in patients experiencing major bleeding or requiring emergency surgery in the next 6 hours. We'll also describe why plasma is not the preferred strategy. We hope that this video will give you a thorough understanding of when and how PCCs should be used.
Prothrombin Complex Concentrates contains coagulation factors 2, 7, 9, and 10. These are the factors that are affected by warfarin therapy or vitamin K deficiency. Each 20 ml vial of PCC contains 500 IU of coagulation factors. Depending on the patient's INR, the typical adult dose is 1,000 to 3,000 IU, or 2 to 6 vials. We will use the dosing recommendations as specified by the National Advisory Committee. The NAC guidelines recommend 1,000 IU if the INR is between 1.5 and 3, 2,000 IU if the INR is between 3 and 5, and 3,000 IU if the INR is greater than 5. Alternative dosing strategies may be weight and INR based. In the setting of life-threatening bleeding, such as an intracranial hemorrhage, a dose of 2,000 IU is given when the INR result is pending to ensure reversal is not delayed.
Warfarin is commonly prescribed in a number of conditions, including atrial fibrillation. It is estimated that 1 in 15 Canadians over 65 is living with atrial fibrillation. Although warfarin is an effective therapy, it is associated with a 2% per year risk of major bleeding. Ensuring the appropriate use of PCCs will result in better outcomes for patients requiring urgent reversal of warfarin.
PCC contains the exact factors and proteins needed for the immediate reversal of a warfarin-related hemorrhage with 25 times less volume than plasma. In addition, plasma is not as effective in reversing INR levels. PCC results in a faster INR reversal and has a quicker infusion time. It is also more quickly prepared because it does not require blood grouping of the patient or thawing and labeling of the plasma units.
PCCs is a lower-risk option than plasma because of a reduced risk of transfusion-associated circulatory overload, or TACO, and transfusion-related acute lung injury, or TRALI. Adverse side effects such as arterial or venous thromboembolism or anaphylaxis are uncommon with PCCs and not known to be higher than with plasma. In clinical studies where patients are reversed for major bleeding, approximately 2 to 4% of patients develop thromboembolic complications when treated with either PCCs or plasma. PCCs are contraindicated in patients with a history of heparin-induced thrombocytopenia because the product contains a trace amount of heparin.
Since 2008, the NAC guidelines have recommended PCC for emergency reversal of warfarin in patients experiencing a life-threatening bleed or needing urgent surgical procedures within the next 6 hours. A typical patient for whom PCCs would be indicated would be someone experiencing an intracranial hemorrhage or a major GI bleed. While maintaining aseptic technique, remove the blue caps from the PCC bottle and the diluent bottle and discard them. Disinfect the rubber stoppers over the powder vial and the diluent vial. Remove the cover of the mix-to-vial transfer and filtering device. While holding the base of the diluent vial with one hand, firmly press the blue end of the mix-to-vial device into the diluent vial. Remove the plastic packaging. With the powder vial placed on a flat surface, firmly press the transparent end of the mix-to-vial device into the powder vial. Maintain pressure until there is a complete transfer of water into the powder vial. With both vials still attached, slowly swirl the powder vial to reconstitute the product and prevent the formation of bubbles. The product should be clear or slightly opalescent when fully dissolved. After reconstitution, unscrew the two parts of the mix-to vial by holding the blue and transparent parts. Leave the transparent attached to the product vial as it contains the filter. Attach a plastic, sterile, disposable 20 mm syringe to the transparent part of the mix-to vial. Invert the vial and draw the reconstituted PCC into the syringe. PCC must be administered intravenously by direct IV push or by infusion using a syringe pump or mini bag. Infuse 1,000 IUs of PCC over 5 minutes. Additionally, the administration of 10 milligrams of vitamin K IV is required for a longer lasting reversal, as the effect of PCC will only last 6 to 12 hours. The INR should be checked immediately after administration and again after 6 hours. Rarely, additional doses of PCC may be required if the INR target is not reached or there is ongoing bleeding. Canadian demographic trends show that as our population ages, instances requiring emergency reversal of anticoagulants will rise.
It is important that we ensure optimal outcomes for patients by the appropriate use of blood products. We hope that we have provided you with information on when and how to use PCCs appropriately for the urgent reversal of warfarin therapy and vitamin K deficiency. Thank you for watching this video.